Welcome to WPS Secure Portal Claims. My name is Karen Curtis and I will be your presenter. I am joined by my friend and coworker Tom Ryan. Tom's going to be helping me out today by watching the chat and providing you with additional information throughout the presentation. You see as we went through this beginning part, he's been adding dial-in information, website links, things like that into the chat. I do want to say all of the examples that I am showing today are from a test environment and they do not represent real scenarios. Now, my goal today is to increase knowledge on actions that can be taken using the claims function within the WPS Secure Portal. We'll look at checking claim status, submitting Part B claims, clerical error reopenings, and overpayment claim adjustments. I will clarify that when I say submitting Part B claims, I am referring to claims that are submitted on a CMS 1500. So those are claims that go through the MCS processing system. Now, before we get too deep into the functions that can be performed, I need to talk a little bit about portal access since you will need to be registered to perform the actions that we cover. I did have a couple people tell me during registration that they were pretty new, so I just want to make sure that we go over that part first. Now, when you visit the WPS website, there's going to be a large box with our logo and the portal login box that you see here. If you click on other pages, the logo is going to disappear, but that login box is going to remain. So under the user ID field, you're going to find a link to register. So on this slide, I've got that outlined in a red box. You will be asked to accept the terms for use for the transactional area and the general area. The transactional area refers to specific actions that take place within the portal, such as data transmission or user interaction. And the general area is broader and it refers to things such as data privacy policies or copyright information. Now, after accepting those terms, you're going to be moved to the provider access page that's shown here on the left. You'll need to enter your MPI, PTAN, and TIN. If you are part of a provider group or clinic, then you're going to need to enter the group NPI and PTAN. You will not be allowed to register using the individual provider's information. When you self-register, a request will be sent to the NPI administrator for your facility or office, and they're going to need to approve or deny access. So this means that you may not be able to log in until your request has been approved. You can also have your NPI administrator create an account for you, and that's going to eliminate that approval process. Now, there is also the possibility that you will receive a message about registering as an NPI administrator, and that is shown here on the right. Now, if this occurs, it means that the NPI that you entered has fewer than 5 administrators. So if you don't get this message, there's no reason to be concerned. There's nothing wrong. It just means that your facility or your office already has at least 5 individuals in that role. Now, if you are not the appropriate person to take on this role, then you simply click no and you continue on with the registration process. Now, to accept the role of MPI administrator, there are certain financial information that must be provided. So you must be somebody that has access to patient, payment, or claim information that would appear on a remittance advice that has been issued within the last 30 days. Now, the portal has 3 different levels of access: eligibility, standard users, and NPI administrators. Eligibility users have access to verify patient eligibility and contact customer service. So the claims function that we're covering today is not going to be available at this level of access. So the picture shown here is of a standard user's homepage. The MPI administrator homepage looks similar, except they have an extra function that's titled Users, which is going to appear on the practice card. The claims option will be what we're talking about today, and that is the third button on the transactions card. So we're going to begin with checking claim status. Now, the claim search functions allows users to check the status of pending and processed claims. It's also the starting point for other claim functions that we will be covering today. To start a search, you're going to select the button labeled Claims. And because status information is pulled from the claims processing system, this is only going to be available if FIS and MCS are available. Each system shuts down nightly at 7 p.m. Central Time, and it comes back online in the morning. So depending on your region, the times can vary, but the portal user manual does have a list. I'm going to have Tom add a link, but I would like to show you real quickly where that is just so you have some idea. From the WPS homepage, if we click over here on the portal user manual, and then we're going to scroll down to claim status. And that breaks the regions out. It also breaks the claims processing systems out. So if you're wondering what time that's going to come up in the morning when you can start looking for claim status, you can refer to this and that'll let you know. So the claim search screen is going to open up once you click on that claims button, and you're going to see the following fields. The service location will be a drop-down box where you're going to select the MPI for who built the claim. There are some users that have access to multiple MPIs, so you just need to choose where that claim would have processed. You're going to enter the patient's Medicare number along with the date of service, start and end date. These fields for the start and end date have a little calendar, so you can click on that and you can go back years. So there really is a broad search range that can be entered. Now in the upper right corner, you're going to notice there's options to register for claim entry, to clear the form, cancel, or search. And the search is going to be based on the data that you entered. Now here you're going to see the results of a Part A claim search. So the claims shown here were processed through FIS. I chose to separate the two systems just because there are differences in the way the information is displayed and also the available actions that can be taken. The search results are going to show me the region. So in this case, it's NTA. This is our J5 national region, which consists of specific providers across the U.S. So I just wanted to explain that in case that's something that you haven't seen before or you're unfamiliar with. The claim number is going to display along with the dates of service and the amount billed. If the claim was finalized, there will be a date in the process finalized date column. Under status, you can see that the top claim is suspended. So this means that that claim is in a location where it's waiting to be worked by internal staff. The bottom claim has been finalized. Under the actions, you're going to find an eye icon, and that's going to allow you to see claim details. Now to the right, there are some acronyms. You have FSC, OCA, CER, and MR. The FCS stands for Finalized Claim Summary, and this is only available for claims that process through the MCS system. OCA is for Overpayment Claim Adjustments. CER is for Clerical Error Reopenings, and MR is for Medical Review. The Medical Review options is going to have its own webinar next month, so we're not going to be covering that today. Now you also will notice that these acronyms are grayed out. So this means that those are not available options for the claims that are shown. Well, if I click on the eye icon next to the suspended claim, then the claim detail screen is going to open up. Additional information is going to include the date the claim was received. You see here there's a type of bill and its location. The location that is shown is MALLO. So this is a location that's going to be created by WPS to hold or suspend claims that need to be looked at by claims staff. Um, there's a box to the right, and you can see that there's a red circle with a line through it indicating that the claim has not been finalized. There's also detailed patient information. To the right, I'm sorry, there's patient information. Then we also have billed information. To the right of that, you have the blood deductible. If the claim was finalized, you'd have a check or an EFT number, and then also the date that that would appear on the remittance advice. Um, as you move down the slide, oh, I'm sorry, there's also a discharge facility type with a little button that says check. You can click that and it's going to allow you to identify and verify the destination or the type of facility the patient was discharged to. So that's something that could come in helpful on those Part A claims. Now, as we move down the slide, you're going to see that there's a reason code that's been applied to the claim, and this banner is going to include a button so that I can receive more information about that specific reason code. Then down at the bottom, we have claim action buttons. So these are going to include add documentation, remittance advice, request a redetermination, and check patient's eligibility. Now, because this claim has been suspended, the remit and the request redeterminations actions are not going to be available. Since the claim is not editing for a reason code that requests medical records, then the add documentation button is also not available. You can, however, check the patient's eligibility, which could be helpful depending on what the claim is editing for. Now, by clicking that More Info button with the reason code banner, then that section is going to expand to display details about that reason code. In this case, reason code 31260 is for fiscal intermediary use only, so there's not action that the provider would need to take. This also explains why the claim has been suspended to an internal location for claims staff to work. Claims details are provided by showing each claim line. It has the service date, HCPCS, modifiers, units, revenue code, billed charges, covered units, non-covered units. There's reason and remark codes. This is not populated on this claim, but we will have examples where it is. And then there's a more info column with the eye icon where I can see details about each line. Now each revenue code, hopefully you can see that there's a little line underneath it, and if you hover your mouse over the revenue code, then a description is going to be displayed. So here I've highlighted that when I hover over revenue code 300, then the description of laboratory appears. So you would be able to do that for each of those revenue code lines. Now here's an example of a finalized Part A claim. So I just want to point out a couple of things that are different from the suspended claim detail. Here you're going to notice that the location is a B9997, indicating that the claim is finalized. The status box is now showing a green check mark and the words finalized or paid. And the EFT number is displayed as well as the remittance advice date. At the bottom, you're now going to notice that those claim actions for download remittance and request redeterminations are now available for this claim. So that kind of shows you how these actions are going to change throughout the claim process and what has happened with the claim. Now here you're going to see a claim search for a Part B provider. It looks very similar to the Part A claim search, except that there are more options available in that actions column. You can see that all of the claims have the FCS for finalized claim summary. Those are all shown in blue. Most have the OCA for overpayment claim adjustment, and there's a couple that have the CER for clerical error reopenings that are available. Now, the Part B claim detail looks a little different than the Part A claims. Provider information is at the top. There's beneficiary information along with the ICN number. Status again is showing a green check mark with the word approved. You can see charges, allowed amount, deductible, provider payment, that's all on the left, while the right is going to show you the date it's received, process date, the check or EFT number, and the check date. Now, there are also more claim actions that are available with Part B claims. So here there are options to add documentation, download the remit, request a redetermination, check patient eligibility, but also you can print a finalized claim summary, and then because of the options available for this claim, then there's the request a reopening or report an overpayment. The Part B line detail is going to show you the date, the place of service, CPTs, modifiers, all of that information that's billed on the individual line. Here there are remarks, reason and remark codes on for these claim lines. And then again, you're going to see these little lines under the place of service. There's a CPT and the reason and remarks code. So again, you can hover over those and it's going to provide you a description. Now, if I choose the more info action on the claim line, which it's going to expand the display to show me the description for those reason and remark codes that have been applied to this line. You can see that there's also an option to request a clerical error reopening. So if any changes need to be made to your claim, you can start the reopening process from here. Now, this is an example of what you see when you select that FCS acronym from the claim search screen or the finalized claim summary action in the claim detail. It really just takes all of the information from your claim and it puts it in this nice little paper form that can either be printed out or downloaded. I don't know if this is something that would be useful for providers, but I did want to show you that this option is available. So now we're going to talk about Part B claim submission. So providers who bill on a CMS 1500 can submit claims through the portal. Unfortunately, this is not an option for providers who submit claims using FIS. Now, the option is available for providers who submit paper claims using the CMS 1500 form. It allows paper billers to receive electronic billing benefits such as quicker payments. This option is only available to Part B providers who have not already registered to submit claims electronically through our EDI department. On this slide, I have included a link to the WPS Medicare EDI department, and this is going to help you with the registration process. Claims submission is accessed by clicking the plus button next to the button that reads claims. So I've got that shown here over on the right side. Now, if you click on that plus button and you have not been registered to submit claims through the portal, you are going to receive a message that is instructing you to click on the claim registry button. So it will give you an option right here so that it will take you to go to register for that. Now, if you click on that plus button and you are registered, then the Start New Claim screen is going to appear. You will need to enter your MPI and then select the radio button for SSN to enter your Social Security number, or EIN to enter your employer identification number. So the first part of that form that you're going to need to fill out after putting in your provider information is the patient information. So I want you to notice, like, underneath each field there's these little parentheses and it says CMS 1500 box 1A, so under the Medicare number. So as you move through this form, it has those little notes that kind of tie it back to that CMS 1500 form. So if you have any questions or you're like, I don't know what information is supposed to go here, there are those little hints to let you know what you should be entering. So here for the patient information, you're going to have, of course, their Medicare number, their name, date of birth, um, their sex, and their address. Now, next, you're going to choose whether you accept assignment or not. So there's those two radio buttons that you'll select, assigned or not assigned. And then you're going to select what type of service you are going to be billing for. So there is a drop-down list, and this box lets you know, I'm sorry, this right here lets you know that you have to pick from the drop-down box, and that the boxes or the entry form is going to be modified based on the service you enter. So here is the list of options that you have. Um, you can go from none of the following apply to my claim, but then they also have, ambulance, all of these different services listed. So it gives you an option of what you can pick from. Now, I am going to take you through these options so that you can see what information will be required. And the reason I do this is just because I don't want you to be surprised by what information it's going to ask you for. So if you choose none of the following apply to my claim, it is going to ask for hospitalization dates related to the service or the current service, and it does say that this is only required if the place of service is 21, 51, or 61. If you select ambulance service, there is quite a lot of information that is going to need to be filled out. It's going to need the pickup location. It's going to need the drop-off location. These little fields with the asterisk means that they're required, so that information will have to be entered. But then it's also going to ask you the reason for transport. So it does give some reasons listed, but it also gives you some boxes where you can kind of free form information that you need to put in. Global surgery. If you select global surgery, it's going to ask you to enter the assumed care date and the relinquished care date. If laboratory services are going to be entered, then you're going to have these boxes appear that are going to ask for the CLIA number and the referring CLIA number. Chiropractic services, it's just going to ask for the initial treatment date. Occupational or physical therapy, you're then going to get boxes for the date that the patient was last seen, a supervising physician's first, last name, and their MPI. If you're submitting a claim for inpatient services, it's going to ask you the admission and discharge date. Mammography services is going to ask for the mammography certification number. And if you select routine foot care as the services you're entering, then it's going to ask for the date that the patient was last seen, along with the physician's first and last name, as well as their MPI. So once you've got your services, what type of services you're going to bill, then it's going to move on to an optional header information. Here you're going to enter the service facility location, the referring provider or other service, and extra information. Now, this information isn't required on all claims, but depending on the type of service that you are billing, the information may be required in order to process your claim. The next section is going to be for entering a diagnosis or nature of illness or injury. And you can see that there is an asterisk next to that one box, so at least one ICD-10 code is going to need to be entered. Next, you're going to move down into the claim entry line. So fields, again, shown in an asterisk, are required. After the line information is entered, then you have a little button down in the right corner that says Save. So you can save that, and then up here in the right corner you have Add a line. So you can enter all the information for one line, save it, and then add additional lines. The portal will accept up to 50 claim lines. Once you're done, you'd go down and you would select the Review button. So next we're going to move into clerical error reopenings. This function can be performed up to 1 year from the receipt of the initial remittance advice. So you have 1 year to make changes to that claim after it's been paid. There are quite a few places to access this option. In the claim summary screen, that's where we looked at those acronyms that were in the actions field. And if you are able to submit a clerical reopening, those acronyms are going to show in blue. I've got that shown here on the left side. Now there's also, when you're in the claim detail, we looked at those claim actions buttons that were at the bottom, like towards the bottom of the section, and it's going to be highlighted in blue if this is an option for the claim. There was also another option when we were looking at the claim detail line. So you've got 3 different places that would show you if you can submit a clear reopening on the claim. Now, choosing this action is going to open the Edit Claim Clerical Error Reopening form. Here you can make any necessary changes. When you're finished, then you're going to click on the Review button in the lower right corner. It's going to kind of run a check and make sure that all of the changes that you made were okay. And if it passes that review, then the portal is going to display a message and say that your information has been successfully reviewed, and to finalize your adjustment request, click the Submit button. If an error is received, then you can either edit to make changes to the claim, or there is an option to cancel the request. The portal user manual does have a list of common error messages and their causes. So if there's something, if you get an error and you're not really understanding why or what's happening with it, you can go back to that portal user manual and it's going to give you a reason why, and hopefully that would be helpful to you. Now, once you click that submit button, then you're going to receive a successful submission message. That's going to include your MPI, the patient's Medicare number and name, and then you're going to get that new claim number. So that's something that you can use later when you're checking claim status. If you want to pull up that new claim number you have to see what's going on with it, That's where you're going to get that from. Instead of having to look at a whole list, you can kind of narrow your search at a later time. Now, overpayment claim adjustments is the last function that we're going to be discussing today. Providers are required to notify Medicare of overpayments and repay Medicare in a timely manner. Now, accessing the overpayment claim adjustment function can be done from the claim search screen. That's again that acronym OCA is going to be shown in blue to let you know that that is something that you can do for that claim. It's also in the claim detail. So when we looked at those claim actions, there's also going to be a blue button that you can select there. Now the report overpayment button is going to open the overpayment claim adjustment form, and this is where you're going to need to indicate the reason for the overpayment. You may need to select a reason for or you are going to need to select a reason for the adjustment from one of the drop-down boxes. There's one for non-MSP reasons, and then there's another drop-down box that is for MSP related adjustments. So for non-MSP reason codes, I apologize, this may be a little blurry. This has things like uh, there's an incorrect per PI, incorrect provider paid, services not rendered. So it gives you, as you can see, a whole options of things that you could be submitting this overpayment claim adjustment for that isn't related to an MSP claim or MSP reason. Now, if the overpayment is related to an MSP situation, then you are going to need to select the type of primary insurance from the drop-down box. If you're not sure of what the patient's primary insurance type is, then you can perform an eligibility check, and there is a tab for MSP information and name of the primary insurance as well as type of insurance it is. So that will allow you to come back here and choose, whether it's workers' comp or if it's an employee group health plan. You'll just need to pick whatever applies. Then you can make changes and you can add that primary insurer's claim information to the adjustment. Now, after all of your changes are made, then you'll select Review. Corrections can still be made if needed. Otherwise, you're going to select Submit, and then you're going to receive a confirmation message, and that's going to include that new claim number, which again can be used to search for status at a later point. Now, I did receive some pre-submitted questions that I would like to go over before I ask Tom if there is anything in remarks. Um, One of the questions I did get was, when is it the most appropriate time to use the clerical error reopening? I do want to show you some helpful suggestions. Let me go out to, I'm going to go to our home page. And again, we're going to click on the portal user manual. And this time, we're going to scroll down. I'm trying to do this a little bit slower in case it bothers people when you scroll too fast. And here we have clerical error reopening, so I'm going to click on that. Now this does give you some situations that can be handled as a clerical error reopening, as well as situations that cannot be handled. So if you're going to do something like you're going to increase the units, or you need to make changes to modifiers, um, changes to the place of service, diagnosis code changes, things like that. Those are all reasons why you could submit a clerical error reopening. If we scroll down here to situations that cannot be handled, um, you cannot add a line of service that was not submitted on the original claim. Um, Increasing both the number of services and the billed amount. That would also be something that wouldn't be allowed. You can't do a reopening on an unprocessable claim. You just submit a new claim and then any corrections that you wanted to make can just be added to that new claim. So there is a list of things that hopefully will help you determine, is this something that I can submit one for or not? Um, the clerical reopening shouldn't highlight in a situation where, if it was an unprocessable claim, if you're going in and looking at the claim detail, then there shouldn't even be the option to submit a clerical reopening. But, um, you know, you never know, it could be an accident. So this is something that can just help you with that process. And while we're out here, I do want to go ahead and address our next question. I was asked, what is the difference between a redetermination and a reopening? And that is a really great question because I think that there can be a lot of confusion with that. A redetermination is for a claim that has been medically reviewed and there has been a decision made on that claim. So maybe it got denied for not medically reasonable or necessary. Now, if you disagree with that decision, and there are appeal rights available, so a lot of times on your remittance advice, you're going to see, we were talking about those reason and remark codes, you're going to see an MAO1, and that's going to let you know that there's appeal rights. So if a claim's medically reviewed, a decision was made, you don't agree with that decision, then you're going to submit a request for a redetermination, and that's going to go through our appeals department. There's also, you're going to submit medical documentation that's going to um, support why you feel that the services were medically reasonable and necessary. Now, I am going to cover this portal function in a webinar. I currently have that planned for April, and so we will go through that whole process if you want to get more information on submitting those redeterminations. Now, a reopening is just for a clerical error. So there was something that was on the original claim needs to be changed. Now remember, you can't add something, but you can change something. So that's going to be when you're going to send those reopenings. And here's another time where you may want to look at this list, and that could help you decide, do I need to send a reopening for this? I also did receive a question about what happens when the portal has been down for an extended period of time. And they were kind of talking about how the portal team handles that. I am not a member of the portal team, but I just, if you are attending today and you did submit that question, I will send that to our portal team and get an answer for everyone to see, what they do when those portal functions come back up. I'm now going to ask Tom if we have had any questions that have come through in the chat today.
Hey, Karen, we do have one question, and it's, can you verify on what type of claims when we would use the QJ modifier? So as a reminder for everyone that's not familiar with that modifier indicates that an incarcerated person must pay their own medical services versus billing the entity that has them incarcerated. So I'm not sure if you want to answer that, Karen, or if you want me to continue what you want to do with that one.
Um, that is since that's kind of more with eligibility, and I'd like to take that question back and then I will send that out in an email. Like I said, there were a couple questions that I got that weren't quite related to today's topic, and so there's a little bit of research that needs to be done, but I will send an email out to everybody in attendance, and we can get those questions answered for you. So if the person that submitted that in the chat, if they wouldn't mind sending an email to our team mailbox that was added earlier, then we could do some research and I could get back to everybody on that.
Perfect. The next question is actually just kind of referencing what you're talking about here, but in reference to the portal information, they want to know where you're going to post that or what you're going to do with that once you get an answer from the portal team.
Oh, sure. I will send out an email to everybody in attendance. So when our webinars end, we we get a report from WebEx that tells us everybody that was in attendance, and it's going to use the information that you registered with. So it'll have email addresses, things like that. So when we have questions that maybe need a little bit more research from our webinars, we get those answers and then we send out an email, and it's going to go to everybody that attended. And don't worry, we're not going to put your email addresses out there for everybody to see. It is going to go like in a blind CC. So everybody's not going to have that information. I don't want you to worry about that. But so if you're here in attendance today, you will get that information in a follow-up email.
So I'm just gonna do this. We have a couple people that said I missed the email, so I do want to remind everybody of a couple of things. Karen's gonna give you the email in a few minutes. If you called in other words, you only dialed in and you didn't actually register with an email address today, you will need to email us. I'm gonna set that aside because again, Karen's gonna give that to you in just a few moments. But um, the next question that came in is also, is there a webinar for reading the eligibility fields?
Yes, there is. Thank you for asking that. I will tell you, I do plan on doing another webinar on eligibility, and the reason I say that is because the last webinar I did was, I think, in January of 2025, and the portal has been updated since then. So I know, like at that time, I didn't have examples of patients that were incarcerated or patients that were in the country illegally, so I couldn't show people how that appeared. And I now have examples for that. So I do want to redo that webinar so that I can show people where to find that information. So that will be coming, I promise.
Karen, just an FYI, if anyone has access to the chat, go ahead and open it up. I did put a link, and yes, I do understand this is a YouTube video, but it's Karen's current encore video for eligibility information. Again, as she explained, she's going to redo it. That was our last question.
Okay, great. Thank you so much, Tom. Now, if you downloaded a copy of today's presentation, you won't see the slide, but it has been added at the request of our reimbursement department. Um, so today we kind of went through and I showed you how an overpayment claim adjustment can be submitted through the portal, and this is the preferred action to be taken just because it's faster. Um, when you click on that, it populates the form for you, and so there's really no, it saves you time and it reduces errors. But if you are somebody that wants to get that paper form and you want to send that in with a check, I do want to show you really quick because there have been some issues that have been occurring. So we're going to click out here for the paper form. And there's this little section up here at the top. So it has contract, and then there's a drop down box to select J5 or J8. There's a Medicare type to select Part B or Part A, and then there's also this section to put a state. There have been some problems with this not being filled out correctly, and what happens is when a check gets sent in, and if that information is correct, then sometimes the funds aren't getting applied to the correct workload, and it can result in errors. It can just turn into a whole mess of things. So we did want to bring this up today and let you know that if you decide that you don't want to use that option in the portal and that you want to send it in using this paper form, please make sure that top section is filled out correctly in order for that overpayment to be processed correctly. Now, when you disconnect from the webinar today, you are going to be redirected to a CMS survey. I'm also having Tom add a link in the chat, and I really do hope that you'll take a moment to provide some feedback on how I did today. If you're watching this as an encore video, then a link can be found in the description. Now, the redirect is going to look like what you see over here on the right, and we show you this because we don't have any control over how it looks, and we just want you to know it's not spam, it's anything malicious. This screen is going to pop up and it says external site, and so we just want to let you know what to expect. Um, the feedback we receive has led to some changes. We've started doing Medicare education expos, which is a whole day on a specific topic. We do take your suggestions for future education topics, and we try to get webinars scheduled for those. So we just really want to provide you with the information that you want. So your opinion really does matter to us. Now, after disconnecting today, you should receive a thank you for attending email, and this is going to contain contact hours which can be submitted for continuing education units. If you joined only by phone, WebEx is not going to be able to generate this email, so you will need to contact us. In the chat, Tom's going to add a link to the education mailbox and what information is needed for us to send you a certificate. This is also the email box that you will use to submit any questions to me that you may have. We will accept questions for up to 7 days after this event. And once again, I am going to send the email out to everybody, and I'll give you those answers that you asked for. That brings us to the end of today's presentation. So on behalf of myself, Tom, and the Provider Outreach and Education team, I would like to thank you for being here today, and I hope that you will join us for future events. Have a great rest of your day, and you may now disconnect.